Oh look, a squirrel! My name is Hannah Skaggs, and this is Common Misconceptions about ADHD in Media versus Reality. A recent study examined the top 100 TikToks about ADHD and found that approximately 52% were misleading. These inaccuracies portrayed in media and Hollywood can lead to several misconceptions, stigmas, and inaccurate self-diagnoses. These common misconceptions include ADHD is only found in hyperactive young boys, ADHD can easily be cured, just focus, it's not that hard, people with ADHD are just lazy, ADHD is not a disability, ADHD is overdiagnosed, everyone has a little bit of ADHD, ADHD is caused by technology, and ADHD medication leads to substance abuse. So what is ADHD? ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopment disorder, meaning it affects how the brain grows and develops. Most individuals with ADHD either lack dopamine or their bodies do not know how to utilize it efficiently. ADHD is classified as a disability according to the Americans with Disabilities Act, which considers it a chronic and debilitating disorder known to impact academic and professional abilities, interpersonal relationships, and daily function. People with ADHD have difficulties with hyperactivity, impulsivity, and inattentiveness. They even have an inability to form daily habits, requiring energy to form even the smallest tasks like eating or brushing their teeth. These are 7 types of ADHD. Almost every person with ADHD has multiple symptoms from various types, but has a dominant ADHD style. These styles include classic ADD, a combination of inattention, hyperactivity, and impulsivity, inattentive ADD, executive dysfunction, overfocused ADD, difficulty switching between tasks, temporal lobe ADD, overreactive, moody, and memory problems, limbic system ADD, fight or flight mode, ring of fire ADD, brain overstimulation in multiple areas, and anxious ADD, anxious and decreased prefrontal cortex activity. Some less commonly known symptoms of ADHD include overthinking, ADHD paralysis, zoning out, daydreaming, clumsiness, failure of auditory learning, eating disorders, hyperfocus, hyperfixations, stimming, impulse spending, emotional dysregulation, anxiety, depression, time blindness, executive dysfunction, and links to autism. ADHD has been linked to genetics, with this being about 70 to 80% of the risk factor. Environmental factors also play a small role. ADHD is not a matter of willpower, it's a matter of wiring. Brain imaging now allows for us to visualize this difference, mostly seen in the prefrontal cortex. Adults versus kids. Many adults struggle with ADHD symptoms, including inattention, impulsivity, and hyperactivity. It just looks different. In a child, this could look like running around the classroom when they should be sitting still, but as an adult, this could be a racing mind or fidgeting during a meeting. According to the CDC, in 2023, an estimated 7 million U.S. children ages 3 to 7 had received an ADHD diagnosis, with an estimated 15.5 million U.S. adults, 6%, had a diagnosis, and approximately one-half of them had received this diagnosis in adulthood. Worldwide, approximately 2 to 5% of adults experience ADHD. People with ADHD are just lazy or unintelligent. This is not true. Many people with ADHD are creative and out-of-the-box thinkers. ADHD is overdiagnosed. This is also incorrect. ADHD has a complex diagnostic process, taking up to 6 hours in length. Studies show that ADHD actually goes underdiagnosed in many populations, especially with women. Everyone is a little ADHD. Not every ADHD symptom is undiagnosed ADHD. ADHD symptoms and neurotypicals resemble symptoms of other mental disorders, such as bipolar disorder, anxiety, and depression. You have to have multiple symptoms of ADHD to actually be diagnosed with ADHD. The medication is where a lot of the stigmas come into play. Strategies and medications actually do not cure ADHD. They simply provide ways to manage it. ADHD medication is highly regulated, making it difficult to become addicted because of that. Professional doctors keep track of symptoms and timelines associated with the medication, and most require you to take stimulant breaks. For someone with ADHD, these medications make them function like a normal person, not like a superhuman. Many people also use multi-treatment systems, including stimulants, non-stimulants, and cognitive behavioral therapy to keep from taking too many stimulants. In reality, the risks of untreated ADHD, such as academic failure, lack of a job, and social issues, are worse than the medical side effects. In fact, some people with ADHD will even have days where they forget to take their medication or it doesn't even work. Approximately 1/2 have used telehealth for ADHD services, such as cognitive behavioral therapy. My ADHD is predominantly inattentive, which looks like severe burnout, ADHD paralysis, clumsiness, time blindness, overthinking, hyperfixations, overstimulation, failed auditory learning, executive dysfunction, laying in bed for hours, and procrastination, among many other things. However, it also looks like my scientific superpower, the thing that allows me to think critically while working in a lab. The truth is, ADHD looks different in every individual who has it. Please remember this the next time you think of the stigmas that the media and Hollywood has placed on us. Thank you.